So surprise medical billing, it's actually a misnomer. It's much better termed a surprise insurance gap because that's actually what it is. So here's how I explain it. Somebody has private health insurance, commercial health insurance, not Medicare, not Medicaid, and they get unexpected care from a provider who's not in their health plan. And because that provider is not in their health plan, they can owe more money out of pocket than they were expecting to pay with in-network care. So a typical example, you're taken by ambulance to an emergency department for an emergency. Well, the ambulance is not going to stop and figure out which is your in-network hospital. They're going to take you to the nearest facility they can get you to for emergency care. Or for a non-emergency condition, a patient has surgery somewhere and they make sure the hospital's in network, they make sure the surgeon's in network, but it turns out that one of the other providers, maybe it's a radiologist, isn't in their health plan. And because that patient and the health plan are not, because that physician isn't in the patient's health plan, the patient can owe more money out of network than they were expecting. And there was widespread agreement. There was consensus in the House of Medicine that we need legislation to address this problem. Now, what's interesting is that some would like you to believe that it's the medical groups who use surprise medical billing as a way to bill patients, maybe drive their revenue. But I have seen no evidence this has been an issue in radiology. In fact, to the contrary, what I've seen is that, or what we hear about, is that insurers have narrow networks and don't always negotiate with provider groups. But regardless, patients don't want to hear excuses. Patients don't care whose fault it is. Patients just want this issue fixed. And frankly, I understand that sentiment. So Congress intended for there to be a single impact: protect patients from surprise medical bills. But some wanted to use the law to empower insurers to reduce provider reimbursement. And that could be a meaningful effect of the law. So taking a step back, the goal of the No Surprises Act, which is that federal law, was to end surprise medical billing while preserving good faith negotiations between providers and insurers, encouraging network contracting. Don't favor insurers, don't favor providers, protect patient access to care, but don't favor either side. But what's interesting is that the laws to end surprise medical billing can have two effects. The first one's obvious: protect patients from surprise medical bills. The second one's less intuitive, but laws to end surprise medical billing have the ability to disrupt good faith negotiations between insurance companies and providers. And some wanted to use the rationale for the law protecting patients to advance another objective: empowering insurers to ratchet down provider reimbursement. And they would talk about savings and how this would benefit consumers. But I want to remind people that if insurers don't pass along that savings, it's just more profit for them. So the law that got passed was a compromise. It was one that nobody loved, but that everybody could live with. It would make insurers more money, but maybe not as much money as they hoped. But then in September, the administration changed the law to benefit insurers. Remember, the law was passed trying to be neutral between insurers and providers. But then an administration rule operationalizing the law fundamentally changed that, benefiting insurers. So then weeks after that was changed with that rule, a major insurer started sending out notices, letters to practices, telling them that these medical practices had to either accept a substantial rate reduction or go out of network, by the way, during a public health emergency. So then last week, a federal judge in the Eastern District of Texas issued a judgment vacating some of the interim final rule the government had issued that related to that change. Now, unfortunately, what will happen next is not clear. We expect the administration's next rule will come out in May and hopefully will provide greater clarity and be within the scope of the law. The single most important takeaway: that the No Surprises Act, that federal law, did its best to protect patients from so-called surprise medical billing without favoring insurance companies or providers. Now, a few of the points that I want to be clear on. This law was always about protecting patients from surprise medical bills. Patients who do everything right shouldn't be hit with these big out-of-network bills. And the House of Medicine strongly supported legislation that would protect patients from these surprise medical bills. And the law that Congress passed did its best to end surprise medical billing without disrupting good faith negotiations, not favoring insurance companies and not favoring providers. Now, the lawsuits that were prompted by the change in the law didn't challenge the patient protections. There was widespread support for those protections. It's hoped that the administration will issue guidance in its next rule that reflects the law that Congress passed, and it will end surprise medical billing without favoring insurers or providers. So, what are my other takeaways? That surprise medical billing is far more complex than some make it out to be. That the law that Congress actually passed was reasonably balanced, and that patient and physician advocacy remain critical.